Okay, you guys want to introduce yourselves?
Hi, my name is Tiffany.
Hmm?
Hi, my name is Kristen.
Mm-hmm.
Hi, I'm Natalie.
My name is Jonathan James Vaughn.
Okay, thank you. That's four. Okay. And I'm starting the timer now. Drugs are expensive. When I talk about drugs, I'm not talking about illicit drugs. I'm talking about prescription drugs. So, according to an online article by the American Hospital Association written on May 22nd, 2024, the inability of many patients to obtain drug therapies due to either high prices or shortages has negatively affected patient outcomes. Nearly 30% of Americans say that they haven't taken the drugs that they're supposed to be taking because they're too expensive. It's estimated that 1.1 million Medicare patients could die in the next decade if that same issue continues. According to the National Library of Medicine, an article written on June 23rd, 2020, the high cost of drugs threatens healthcare budgets, which means that people start having to pay out of pocket, which nobody wants to do. The Center for Health Analytics, Research, and Transformation wrote an article on February 1st, 2019, saying that the rate of growth in drug spending in the government's portion of health spending, is volatile. That means basically that the government has a certain amount of money that they normally spend on health spending, and the percentage of that, although it's only 10%, that is related to drug spending, is increasing at an exponential rate. I argue that corporate greed has caused a lot of these drug prices to rise. While there are hundreds of issues in the drug industry, I'm just going to focus on three major points, which are monopolies, the process of obtaining drugs, and what is being considered next by different people. So, there are a lot of major monopolies controlling the drugs that we use. The website Health Affairs wrote on December 2nd, 2024, that in the year 1997, the FDA loosened rules around direct consumer advertising. That led to a huge increase of branded drug ads. That doesn't really seem like a big issue. Okay, whatever, there's brands that are making advertisements for their drugs. Well, during this time, consumers were shielded by the true drug prices, which meant that their insurance and Medicare providers were working with these drug companies and creating prices for the people that they didn't know they had other options for. The DTC advertising caused consumers to demand their health plan's carrier to pay for all of the drugs, which in the end reduced the plan's ability to encourage the use of real preferred products, and overall it reduced the possibility to negotiate the prices of those drugs. The Commonwealth Fund wrote an online article on May 14th, 2018, saying that once the drugs are approved by the FDA, monopolies that created these 20-year-long patents on the drugs are assured that they can have their pharmaceutical companies that are releasing their drugs to charge whatever price they want. That meant that even if the people wanted some other price, it doesn't matter at all. Since these monopolies had so much power over their drug that they had a patent over, they could charge whatever they want, and people had no other option but to spend that money. The only way to not have this issue is to not allow these large companies to create these massive patents that last so long, but instead to have smaller companies also be able to produce and sell these similar drugs. Now, why is making and selling drugs so expensive? Well, according to the AHIP, an online article written on June 21st, 2024, the largest drug makers in the United States spend only 22 cents out of every dollar on research and development. The United States Food and Drug Administration wrote an online article on October 30th, 2019, saying that only 28% of the manufacturing facilities making active pharmaceutical ingredients, or APIs, are domestic, meaning that they're in the United States. That means that the other 72% of them are overseas, and 13% are from China. That specifically has been a massive increase over the last decade. In fact, the amount of drugs that we have been creating, or drug ingredients that we've been creating in China, has doubled in the last decade. That is extremely expensive. Creating domestically is cheaper in the long run because you don't have to worry about what might happen with our political issues at the moment. What I mean by that is, let's say we have these companies that are selling these products to us from overseas. What happens if we happen to be in alliance with someone that they're in a war with? Or what happens if we decide to get in a war with them? Or they have some sort of major issue that destroys their factories? Well, we can't do anything about that. We just have to deal with the fact that we can't have those ingredients anymore. And then maybe spend massive amounts of money into creating factories to produce it. So instead, the most ideal way function in these scenarios is to create our own ingredients. That way we don't have to pay any import fees or anything like that. Now, what is this issue causing? According to bramnicklaw.com, an online article wrote on October 27, 2020, the black market for prescription drugs is booming as more and more people start looking to save money by acquiring opioids through illicit means. What that's been meaning is that a lot of drug users find that heroin is a much cheaper and more, let's say, fun alternative to prescription painkillers. Now, one interesting solution that I found is happening with this massive increase in drug prices is that people are finding their own solutions. And specifically, people are turning towards using more natural remedies, older remedies. Now, some remedies I've seen are tinctures, people talking about how going in the sunlight is healing you in ways that drugs might not be able to. People have been eating foods high in zinc to reduce the chance of getting sick. And a very large one ever since the legalization of marijuana is smoking marijuana. That one I've experienced a lot in my life. I have a lot of family members that did not like painkillers, drug painkillers for whatever reason, whether it be they don't think that it's good for you or it's gotten too expensive, and they've shifted on to using marijuana for medical reasons, for back pain, and many issues like that. So, I've talked about these major issues with monopolies, why the process of creating drugs is causing issues, and what people are considering next. And I hope that I've convinced you that corporate greed has caused the main problem when it comes to the prices of drugs increasing. And all this to say, we could possibly make something good come from this abuse of power coming from the drug monopolies. Oh, do you guys want to say hi or bye?
Bye. Bye.
The other ones are saying bye too. Great, thank you, bye.
Goodbye.